Welcome and thank you for joining us today.
Hey, thanks for having me, Dr. Mercola. It's a real pleasure and an honor to be here.
All right, so you've written a paper that was an interesting paper. It was the COVID-19 data, how CDC violated federal law to inflate cases and fatalities. So why don't you discuss a little bit of, I guess, about your history, how you got interested in this, and what motivated you to write the paper?
Well, we started on March 12th looking at the data. We knew that there was going to be some issues. So what I started doing on March 12th was going through all the data we could find from the Italian Ministry of Health and also from South Korea. We couldn't validate any of the data coming out of China. There was just no independent way to do it. So what we were seeing out of Italy and out of South Korea was that we were going to be concerned about people who are over 60, over 70 years of age with pre-existing conditions. That was the main thing coming out of that data. So we were expecting the same kind of trends here. But with so much chaos, especially in late February and March here in the United States, it was like, well, we better start looking at this data pretty close. So what I started doing was tracking the data on a daily basis from each state health department. And then making sure that what the CDC was reporting was matching up. And what we started to see very early on were some significant anomalies between what the states were reporting and what the CDC was saying. And it was concerning because the variance was growing with each day in the data. So, we have an old saying, I'm an old data collector. So we say when garbage in equals garbage out. And that was the concern because we knew the public health policies are going to be based upon the data. So accuracy is of the paramount importance. And then we started delving in a little bit deeper into how the CDC was supposedly collecting their data. And that's where we saw the NVSS, the National Vital Statistics System's March 24th guidelines on it, which were very concerning. And we saw the CDC adopt the Council for State and Territorial Epidemiologists paper on April 14th. And what was incredibly concerning about this, Dr. Mercola, was that it was all done without any federal oversight, and it was all done without any public comment, especially scientific comment. And that became increasingly problematic, especially when we started to see discrepancies in the state of New York alone on the thousands of fatalities, what the statement of New York was
So,
reporting.
well,
Oh,
why don't we
excuse me.
stop there? Because in March, this is a really important part of the data that you dug out, is that there
Mhm.
was a shift, this change in the definition of what a fatality was. So why don't you walk us through what the definition was before March 24th and what it changed to after that date, and then who in the agency had the authority to make that change without any supervisory uh, contribution.
Well, prior to COVID-19 and 2020, we had what was called a handbook on death reporting that has been in use since 2003. And it's been in use really without incident. And the key feature of it is that on a death certificate, there are two key sections. There's part one, which is going to talk about cause of death. And then there's part two, which is going to talk about contributions to death. Now, contributions to death are not necessarily going to be statistically recorded. It's just a fact of to have a thorough record. But part one is very important for statistical counting. And what we saw in that March 24th document specifically was that they were saying that COVID-19 should be listed in part one for statistical tracking, but in cases where it is proven to cause death, or what was key, assumed to have caused death. And what was really concerning about this document was that it specifically stated that any pre-existing conditions should be moved from part one, where it has been put for 17 years, down into part two. And so it was basically taking this and saying, we're going to create exclusive rules for COVID-19, and we're going to do a 180 for this single, disease, virus, whatever you want, however you want to look at it. And we're going to create rules exclusive for this. And with that, the big problem with that is now you remove the ability for a medical examiner, a coroner, a physician to interpret based upon their collective health history of that patient who's unfortunately passed away. You remove their expertise and you say you have to count this as COVID-19. And that takes on an added measure when you incentivize it financially. And that's what we saw with some of the Medicare and Medicaid payouts. And that was very concerning. Now, to answer your second question, who has the authority to do this? The answer should be no one. The answer should be a federal agency has the ability to propose a data change. And in proposing a data change, they're supposed to register it in the Federal Register, which then initiates two things. Number one is federal oversight by the Office of Management and Budget. And then number two is an opportunity for public comment on it. And without registering it, there is going to be no oversight. There is going to be no public comment. And what's happened essentially is that the people who enacted it just went ahead and did it. They acted unilaterally, and that's not how our democracy is supposed to work.
Yeah, has your investigation been able to identify the specific culprits within the agency who made this decision, or is it hidden?
We haven't been able to, and that's why the thrust of this paper, the spin-off, if you will, for this paper is we have sent out formal grand jury investigation petitions to every U.S. attorney and the Department of Justice requesting a thorough, independent, transparent investigation of this, because they would have the ability to call a grand jury, and that grand jury would have the ability to subpoena all those records to determine which people were at fault.
Okay, so that sounds just in of itself pretty nefarious and a crime and should be investigated. But the implications of that transition, that shift, that change in the definition of the cause of death that occurred in March of this year had dramatic implications or consequences on how this pandemic impacted our lives. So we've got a few questions in there, but why don't you help us understand in more detail how dramatic a change occurred when they made this shift in the definition? I mean, and what the consequences of that?
Sure. Well, the consequences. If it's all right, I'm going to just reference the paper because I'm hoping some of the folks will want to read through the paper and decide for themselves.
It's open access. It's available online, right?
100%. It's peer reviewed. It's been we've accumulated, Dr. Mercola, about 10,000 hours of collective team research into this. It's been reviewed by 9 attorneys and a judge for accuracy. It's been gone through the peer review process before being published. We feel like it's tight.
Good.
So on page 20 of the paper, we have a big graphic, and that graphic shows what the estimated actual fatality count should have been as of August 23rd of this year. So what was reported on August 23rd was 161,392 fatalities caused by COVID-19.
Okay, and this is just to repeat, you said it, but I just want to make it clear. This is August 23rd.
Correct.
So a few months ago.
A few months ago, correct. Had around the country, we used the guidelines from 2003 that the CDC published. These guidelines come from the CDC. So why we are creating a new set of guidelines for COVID-19 is beyond me. These have been working fine.
Wow. We're going to talk about why that's the case. Because I'm sure you and I both have some suspicions.
Yeah, we have suspicions for sure. And but by comparison, so using the new rules from March 24th, 161,392 fatalities as of August 23rd. Had we used the 2003 guidelines, our estimates are that we would have roughly 9,684 total fatalities due to COVID-19. That's a significant difference. That's a difference on the scale of really as much as 96%. The range that we came up with and calculated, Dr. Mercola, was 88.9% to 96% inflation.
That is crazy. So I'm curious as to how this syncs up with the shift in the, or at least it wasn't a shift. It was an acknowledgement by the CDC in late August of this year that the people who died of COVID-19 by themselves was only 94% of the numbers that they gave, and the others had significant coexisting significant comorbidities that contributed to it. So is this a parallel confirmation, or how do you align those two data points together?
Our suspicion, let me read that exact quote from the CDC that you're referencing. For deaths with conditions or causes in addition to COVID-19, on average, there were 2.6 additional conditions or causes per death. That means that the average person that was listed as a COVID-caused death had 2.6 pre-existing conditions: diabetes, renal failure, COPD,
obesity,
just major risk factors.
Vitamin D deficiency.
Oh, all over the place, right? Yeah. Probably the grandest thing we've seen in this.
Well, it's one of the big ones, but it's not the only one for sure. For
sure. To speak to that point, when you look at this, for absolute 100% accuracy, we'd have to do something like we were just alerted to by a whistleblower this week out of the state of Florida, where they've actually gone in and re-examined every single death certificate and the medical records with them. And what they found was that roughly 80% of the fatalities should have been were wrongfully classified as COVID-19 fatalities.
So 80% in the carefully, individually analyzed data in Florida. Is that the entire state of Florida? Or was it the
entire state of Florida? Yes.
Wow. That's where I live, so it's relative to me, or relatively important to me. But it's certainly to the whole country, because that confirms what the CDC data suggests and what you've identified. I mean, that's pretty incredible if you think about it. That they're able to get away with this and use that. You see, I just want to interject here is that the mainstream media is justifying this course of action based on science. Yes. And the foundation of the science really is focused on the accuracy of the people who are dying. Otherwise, it's absolutely inflated, and we're making decisions that are at best inappropriate, and at worst causing far more complications than there's out.
The collateral damage is extensive. We have not even seen accurate counts on the number of suicides, but we have reports that they're up by as high as 1,600% this year.
That's 16 times.
That's 16 times.
That's crazy.
Yeah. We haven't seen the final reports on the number of businesses, especially small businesses, family-owned businesses that have gone out of business this year. But the suspicion is that we're in the hundreds of thousands there. And I think that, when we look at the potential mental, and this is something that's very dear to my heart, there's two things about this, Doc, that really bother me. The first is that what is the mental health impact to our children? And what is the long-term mental health impact to our children? That is of a grave concern to me right now, especially.
Do you have children?
I do. I'm a dad, first and foremost. I'm a dad, and then the second thing, I lost my mother in 2002. And, I think the grace of it all was that we were able to get her out of the hospital and fulfill her last request, which was to pass away in her bed with family around her. And I just grieve for every single person who's lost someone this year who was not able to be there. Americans should not have to die alone because we're worried about some virus that they're telling us is a problem, when the data, even the data that we know to be inflated and fraudulent, is still doesn't suggest the virility that they want us to believe. I just have a problem when I see with the thought of Americans dying alone, especially our elders dying alone when their loved ones can't get in to see them. That rubs me the wrong way, in a big way.
Yeah, it is definitely one of the largest atrocious crimes being committed, or that has been committed, and potentially will continue to be in light of what appears to be new lockdowns that are being implemented for this coming winter that they love to refer to as the dark winter.
Mm-hmm. They're good.
Yeah.
The powers that be are good.